अस्सलाम वालेकुम, वेलकम टू माय चैनल डॉक्टर शामी सेज। तो SK16 के सर्जरी सीरीज़ का ये थर्ड पेपर है जो मैं डिस्कस करने जा रहा हूँ। सर्जरी 24 मई मॉर्निंग। सो क्वेश्चन नंबर 1, विच ऑफ द फॉलोइंग इज लोकली मैलिग्नेंट ट्यूमर दैट इज एम्ब्लोब्लास्टोमा। क्वेश्चन 2, अ पेशेंट प्रेजेंटेड विद द फुट ड्रॉप एंड अनेबल टू डू डॉर्सीफ्लेक्शन एंड इवर्जन ऑफ फुट, विच नर्व इज डैमेज दैट इज चार्ली CPN। यू हैव टू करेक्ट इट। ये टिबियल नर्व नहीं है। डॉर्सीफ्लेक्शन और इवर्जन अगर अफेक्ट होती है तो CPN नर्व डैमेज होगी। Third, a child after 2 weeks of vaccination develops petechiae and presented with the bleeding and has the platelet count of 10,000. The diagnosis is ITP. 4, 18-year-old girl presented with epistaxis and the ecchymosis on the bone marrow aspiration. There is hyperplasia of megakaryocytes. The most likely diagnosis is ITP. Fifth, the blood supply to the uterus is from Charlie ovarian plus uterine artery. Next, 6, gastroduodenal artery is the branch of hepatic artery. 7, during endoscopy of 32-year-old woman, ulcer is found on the posterior wall of the stomach. It is likely to cause the bleeding by causing damage to the delta, that is splenic artery. 8, structure passing anterior to the third part of duodenum is beta SMA. 9, CA of the tail of the pancreas, resected damage in which ligament occurs, that is lieno-renal ligament. 10, a patient have esophageal mass during esophagectomy. Stomach is mobilized to upper portion of thorax to anastomosis with pharynx. Which artery is mobilized for the stomach supply, that is right gastroepiploic artery. 11, a patient sustained injury to the posterior head and occipital bone resulted in the vision loss. Artery involved is posterior cerebral artery. 12, transitional epithelium characteristic is superficial cell dome shaped appearance. 13, a patient after artery A with the damage to the temporal bone. Which artery is involved, that is delta anterior branch of middle meningeal artery. 14, female having UTI, gynecologist advised urinary shows pus cells. Organism is gram positive, catalase plus coagulase negative. Which organism is involved, that is Staphylococcus saprophyticus. 15, patient had internal jugular lymph node biopsy in the neck region. After that he developed numbness of ear lobe. Which of the following nerve got injured, that is the greater auricular nerve. 16, patient having difficulty in writing and reading language comprehension, area damage is Wernicke area. 17, a 12-year-old boy presented with the diarrhea not responding to the routine anti-diarrheal treatment. Jejunal biopsy shows partial villus atrophy with many PAS positive macrophages. Most likely diagnosis is the Whipple disease. 18, patient had injury in the upper arm beneath axillary area near floor. What will be injured, that is intercostobranchial artery. Injury to the lunate will damage median nerve, Charlie. Next, 20, a patient climbed a peak with a heavy bag on his shoulder. After that he developed loss of adduction of arm with the loss of flexion at elbow and the loss of extension at the wrist. Most likely damage occurs to which of the following, that is upper part of the brachial plexus. 21, adductor magnus is supplied by the obturator nerve. 22, the bicep femoris is supplied by the tibial nerve and the common peroneal nerve. 23, a cardiac patient presents to the emergency on examination. He had a collapsing radial pulse alongside diastolic murmur. Which is the probable diagnosis, that is delta aortic regurgitation. 24, increase ECF potassium. What will be effect on the heart, that is the diastolic cardiac arrest. 25, the patient with the MI died even after aggressive management. Likely cause is the cardiogenic shock. 26, the pregnant lady with the labor pain for the 2 hours developed dyspnea and the died within the 15 minutes of labor. Most likely cause is amniotic fluid embolism. 27, the Kaplan-Meier curve indicates which of the following, that is survival of the patient. Which of the following are the spore forming bacterias, that is alpha the Clostridium tetani. 29, the most common characteristic sign and the symptoms of food poisoning due to the Clostridium botulinum is flaccid paralysis of respiratory muscles. 30, horse rider fall and the stretches some days ago presented with the lockjaw and the spasm. This is due to the tetanus toxin. 31, the Stenson's duct anatomical location is the buccal space. 32, the person with the difficulty in swallowing. There was some white growth inside esophagus with the pseudohyphae. Likely reason is the candidiasis. 33, whitish discharge from vagina is caused by the candida. 34, a young woman has the puffy skin and the horse voice. Her plasma TSA concentration is low but increase markedly when she is given TRH. She probably has delta hypothyroidism due to primary abnormality in the hypothalamus. 35. A patient undergoing thyroidectomy at upper lobe, the nerve likely to be injured in the vicinity of the superior thyroid artery, that is external laryngeal nerve. 36. The patient undergoing thyroidectomy at the lower lobe develop harshness of voice, nerve injured in the vicinity of inferior thyroid artery. Ligation is recurrent laryngeal nerve. Next. 37. The colleagues complain about a 30-year-old woman who forges signs or important documents in search for the belongings of others in their absence, has joined another company and started smoking. He has history of taking some drugs. What test would you like to do for the psychiatric evaluation, that is the urine screening for the toxicology? 38. The baby with the frontal and occipital bossing and has large head due to the premature closure of which suture, that is sagittal suture? 39. The patient diagnosed with a terminal ovarian cancer told you not to tell their family. In a few days, his son and the daughter came to your clinic and asked you about the patient. What to do? That is, tell them nothing. 40. Which of the following structure lies parallel and the deep to the carotid sheath, that is the sympathetic? 41. If we cut one side of the cervical sympathetic chain, what happens to the ipsilateral side? It is beta meiosis. 42. A stab wound in the fifth intercostal space, which is 4 cm deep, damages which structure? That is the pericardium. 43. First branch of abdominal aorta is the celiac trunk. 44. The tumor of eye least likely to metastasize is the BCC. Charlie. 45. The basal carcinoma most common type is delta nodular. A couple who is married from the 10 years have no child. Husband has a history of parotid swelling. Which of the following the responsible for this? That is mumps. 47. Ewing sarcoma translocation is T11:22. Next. 48. The female patient presented with the increased menstrual bleeding. Imaging shows the endometrial hyperplasia. It is more likely due to the excess of which hormone? That is estrogen. 49. IgE receptors on the alpha mast cells. 50. The patient present with the painless testicular swelling and diagnosis the tumor. Testicular tumor drains into which of the following group of the lymph nodes? That is the retroperitoneal lymph nodes. 51. In ECG, complete ventricular depolarization in the beta, that is ST segment. 52. The vein accompanying left circumflex artery is which of the following? That is the anterior cardiac vein. Next. 53. The antigen processed by the exogenous epitope presentation pathways are presented with which one of the following? That is Charlie MSC class 2. 54. Effect of the glucagon on the heart is like the epinephrine. 55. In moderate exercise, what happens? Increase in the cardiac output. 56. Extreme left shift of hemoglobin oxygen curve is due to which of the following? That is the carbon monoxide poisoning. 57. Thirst is increased by the increased angiotensin 2. 58. A person loses 2 liter of the sweat while working and drinks 2 liter pure water. What changes will occur? Increase in the ICF volume in this particular case. 60. Posterior external arcuate fibers form delta cunicocerebellar tract. 61. Which muscles are involved in the forceful inspiration? That is diaphragm plus external intercostal, SCM, serratus anterior and sacral muscle. 62. A man smoked 20 packs per month from 30 years, developed lung cancer. Which carcinogen in the cigarette causes the lung cancer? That is the hydrocarbon. 63. In if the perineal body cut, which muscle is damaged? That is bulbospongiosis. 64. A lady presented with the fever in the jaw abscess with draining sinus and the yellow granules. Causative organism is actinomyces. 65. The definitive diagnosis of the pneumonia is by which of the following? That is Charlie sputum culture. 66. Recent thrombus consists of fibrin. 67. White blood cells enter the lymph nodes through beta, that is subcapsular efferent lymphatic. 68. Thyroglossal cyst common location is the anterior triangle. 69. The peripheral neuropathy secondary to isoniazid is reversed or the prevented by Charlie B. So 69. Charlie. 70. A patient has anemia and hypersegmented neutrophils present on the peripheral blood examination. What is the cause? It is the folic acid deficiency anemia. 71. History of trauma to the scrotum, anterior abdominal swelling and the rupture of delta, that is spongy urethra. 72. 60-year-old businessman is evaluated by the physician for his high BP, which was 185 by 130 mm. Lab revealed increased plasma renin activity. His plasma aldosterone level is high. Left renal vein renin level is high and the right renal vein renin level is decreased. Most likely the diagnosis in this case is alpha which is left renal artery stenosis. Next, 73, separation of the shoulder joint with lateral end of clavicle sliding over acromial ligament injured is the beta coracoclavicular. 74, pathologist wants to pass diet to the liver, it will reach through alpha ligamentum teres. 75, a 68-year-old woman with a uterine carcinoma undergoes surgical resection. The cancer can spread direct to the labia majora in the lymphatic that follow. Which of the following, that is E, the round ligament of uterus. 76, 55-year-old woman present in the OPD with the prolapsed uterus and intact anal canal due to the intact Charlie, that is external anal sphincter. 77, which part of the intestine thick loop with less mesentery fat and long vasa recta with her arcade, surgeon asked by uplifting of the gut during the surgery, that is beta, that is jejunum. 78, anesthetic that causes the bronchodilation in the asthma is the beta ketamine. 79, which of the following decreases the secretion of growth hormones from the anterior pituitary, that is somatostatin. 80, ADH level decreases by the delta increased plasma volume. 81, sportive cells of the pars nervosa are beta pituocytes. 82, a mother has a child of 10 years diagnosed with meningitis and now she asked that another child 4 and 6 years old at risk of meningitis tell her the route of the spread of infection, that is the respiratory droplets. 83, the posterior pituitary is affected by which of the following will decrease, that is delta ADH. 84, the ascent of the horseshoe shaped kidney is prevented by E, that is inferior mesenteric artery. 85, the patient with the history of the severe chest pain crushing in nature radiating the left arm of 2-hour duration. ECG is inconclusive, which cardiac enzyme will be raised, that is the myoglobin. 86, the patient has the primary amenorrhea, short stature, webbed neck, most likely diagnosis is the Turner syndrome. 87, 4-year-old boy was attended to the clinic and was observed to have the short neck, low hairline in the posterior aspect of neck and was known to be suffering from heart condition. X-ray shows the fused cervical vertebra. On examination, limited movement of upper limb was noted. What is the most likely diagnosis? That is the Klippel-Feil syndrome. 88, a man presented with the generalized body swelling for the 2 weeks. Physical examination shows thick waxy skin, hepatomegaly and large kidney. 24, our urinary protein was 4 gram per day. Kidney biopsy shows apple colored bifringes, fibril under Congo red stain. What is the diagnosis? That is a multiple myeloma. 89, in cubital fossa most lateral structure is delta radial nerve. 90, if one does a laminectomy to expose the spinal cord, which ligament must be removed? That is Charlie ligamentum flavum. 91, which of the following supplies suprarenal gland, that is alpha greater thoracic splenic nerves. 92, maximum organ saturation is found in beta umbilical veins. 93, 2 alpha and the 2 gamma chains in delta, that is the fetal hemoglobin. 94, tumor marker of medullary carcinoma is the Charlie calcitonin. 95, follicular carcinoma of thyroid metastasized to which organ? That is the lungs. 96, the fracture of head of femur lead to the vascular of head artery involved in which of the following? That is Charlie medial circumflex artery. 97, the gamma radiation sterilization used to sterilize which instrument? That is the syringe needles. Cystic hygroma is seen in that is Charlie the Turner syndrome. 99, of the following cells present in between interalveolar septum, that is alpha macrophages. 100, the positive feedback is in the childbirth. Next, 101, the pregnant woman having increased abdominal grip size and uterus changes likely due to the alpha, that is the normal physiological changes. 102, the mitral stenosis ECG shows the P mitral in the lead to. 103, in nutmeg liver cause is the delta, that is the chronic congestion. 104, about vitamin D true is that is alpha. 25, hydroxylation the liver and 1 alpha hydroxylation in the kidneys. 105, the patient with the renal artery stenosis may present with the high blood pressure due to the increased renin secretion. Which of the following structure in the kidney is responsible for sensing inadequate perfusion and secreting renin? That is Charlie juxtaglomerular cells. 106, the drugs given after meal due to beta decreased GI disturbance. 107, a 61-year-old woman is brought with the bleeding per vagina. She is diabetic and hypertensive. 1 year back, she was diagnosed as having the carcinoma of the breast. What can be the most probable diagnosis of this bleeding PV? That is beta carcinoma of endometrium. 108, the anterior to the left suprarenal gland is beta laser sac. Next, 109, a patient ABGs with PS 7.37, participation carbon dioxide 50 and the bicarbonate 30. What is suitable interpretation? That is respiratory acidosis and the metabolic alkalosis. 111, ketogenic amino acids alpha lysine and leucine 112. 16-year-old boy presented the OPD with a 104 fever for the last 4 days and prescribed antimalarial for the fever. After 12 hours he presented with the cola color urine. What is the cause? That is G6PD deficiency. 113, non-diabetic female having chronic rhinosinusitis developed fungal infection that shows septate hyphae at acute angle and producing respiratory symptoms. Most likely the fungus is the Charlie, that is Aspergillus. 114, 9-year-old boy admitted for the surgery, complaints of dry mouth. Examination shows the white patches in the mouth, difficult to eat and swallow. What should be the treatment? That is Charlie McCon. 115, the free nerve endings detect which of the following? That is pain. 116, regarding thermoreceptors, best is large receptive field. 117, the low frequency vibration detected by the Meissner's corpuscles. Next, 118, which tumor involved extension to the nerve sheet and cause the parotid swelling? That is the carcinoma X pleomorphic adenoma. 119, diffusion of gas directly proportional to available surface area. 120, CSF in the normal condition is the beta 10 centimeter water pressure. 121, atria stretch leading to the tachycardia. This is Charlie, there is a brain bridge reflux. 122, a patient whose cuboidal bone crushes by run over accident by the light vehicle, which muscle will be affected? There is the delta, the tibialis posterior. 123, the T cells involved in which disease? Alpha type 1 diabetes mellitus. 124, the patient chest pain with the MI suddenly on autopsy. What will be the findings? The coagulative necrosis. 125, in 60% of the body fluids, how much of it will be present in interstitial fluid? That is 11 liters. 126, Hodgkin's lymphoma virus involved will be Epstein-Barr virus. FFP is given for the immediate treatment of that is Charlie warfarin toxicity. Next, 128, the pregnant lady with the AFib drug given should be IV heparin. 129, IgE receptors on the mast cells. 130, the female present patient was transfused with the blood after 3 days, became dyspneic and died most likely due to the ABO incompatibility. 131, the patient got scarred on watching something. He got goosebumps. What is the mechanism? That is the constriction of erector pili muscles. 132, the most radiosensitive tumor is alpha, the brainstem glioma. 133, which factor present in the serum while others produce and consume? That is beta factor number 7. 134, a 29-year-old female presents with the lethargy and irritability for the last 5 years. Labs reveal HbF 9/6, MCV 70 and MCSC low with the normal white blood cell count and the platelet count. She was prescribed iron supplements, yet after 2 months she had the HB 10.2. Where lab investigation should be ordered to find the underlying cause of the persistent anemia, that is HB electrophoresis. 135, type of immunoglobulin in the RH incompatibility is IgG. 136, type of immunoglobulin in the RH incompatibility is beta IgG. 137, most lethal toxic local anesthetic is delta bupivacaine. 138, PUG obstruction at which level? That is T12L2. 139, accessory cervical rib arising from the transverse process of cervical vertebra may cause damage to T1. 140, the benzodiazepine barbiturates and the other anticonvulsants work by acting on which neurotransmitter? GABA. 141, the neurotransmitter of the mood is the serotonin. 142, the patient after fall on the outside hand with the trauma on the wrist develops dislocation of the lower portion of the joint posteriorly and the medially. Most probably he has the Colles fracture. 143, 60 years old male with the splenomegaly, inguinal lymphadenopathy, read Sternberg cells, blood show lymphocytes, eosinophils, that is the beta Hodgkin type 2. Hodgkin type 3. 144, a patient has the complaint of night blindness and diarrhea. There is the corneal ulcer, coplic and the biter spot due to the deficiency of vitamin A. 145, the first manifestation of vitamin A deficiency is delta night blindness. 146, change in the size, shape and polarity is caused beta dysplasia. 147, a patient presented with the right-sided hemiplegia without sensory loss. Lean is at which side? That is the left internal capsule. 148, the pulmonary artery supply is delta alveoli. Next, 149, to anesthetize the perineum during the delivery, a pudendal nerve block is performed. This nerve block may result in urine incontinence due to anesthesia of the muscle lying in the urogenital diaphragm. 150, regarding esophagus epithelium, true is beta, entire esophagus is stratified epithelium. Next, 151, the chronic villus sampling done at which week? That is 11. 152, the patient eating daily from the street vendor hospitalized for 2 weeks, and amoebic infection reaches lungs via direct extension from the liver. 153, aspiration of vomiting by the lady during the seizure, it can be prevented by beta closure of the false vocal cords. 154, bladder supply in which ligament? that is alpha dorsolateral. 155, the introduction of the cold water into 1 year may cause the giddiness and the nausea. The primary cause of this phenomena is delta, the creation of convection currents in the endolymph. 156, the neutropenic hypotensive patient admitted in the oncology ward with the history of dysuria, high grade fever. Blood culture yielded growth of the aeruginosa. These findings suggest disease resulting by excessive release of which of the following bacterial product, that is the endotoxin. 157, epinephrine causes Charlie increased glycogenesis. Patient came to ER with a severe dehydration. After initial resuscitation, it was found that she had the resection of the part of GIT, but she does not remember which part it was, and that is the Charlie ileum. 159, iron stored in the form of the ferritin. 160, less desensible part of the urethra is the membranous part. 161, lymph nodes involved in the infection of the glans penis is D, the deep inguinal. 162, the femoral artery pulse is felt at Charlie, that is mid-inguinal point. 160, the lateral relation of the upper part of the vagina is a ureter. 164, the low molecular weight heparin activates alpha antithrombin 3. 165, the chronic diarrhea not responding to antibiotics, crease and shape organism is seen. Diagnosis is Charlie, that is Gardia. 166, regarding urinary bladder, true is alpha motor supply by the sympathetic and the parasympathetic. Next, 167, the Chagas disease and the congenital megacolon affects which layer of the GIT, that is delta muscularis externa. 168, fetal blood leaving placenta having oxygen is beta 30 mm. 169, the GBM act as a strict barrier due to which kind of lamina, that is beta lamina externa. 170, which type of inflammation is appendicitis with the pus cells in it, that is beta suppurative. 171, the primary villus consists of which cells, that is Charlie, cytotrophoblast and syncytotrophoblast. Next, 172, the hemorrhagic cystitis is the side effect of which of the following, the cyclophosphamide. Kaplan-Meier curve indicates which of the following, that is E, survival of the patient. 174, equal chance of each person being selected in a study is random sampling. 175, person with a megaloblastic anemia with the oval macrocytes and intrinsic factor given diagnosis will be beta cobalamin deficiency. 176, the patient has the primary amenorrhea, short stature, web neck, that is definitely Turner syndrome. 177, the meniscal tear occurs in Charlie, fully flexed knee and the lateral rotation. 178, an old man was playing with his grandson in the garden, experiences the pain in his right toe. He was febrile with redness in the toe. CRP positive, culture negative, and synovial fluid analysis revealed the birefringence negative, that is acute gout. 179, the clear cell carcinoma of ovary is beta, the serous carcinoma. 180, lymph node biopsy from the posterior triangle done, which structure will be damaged, that is accessory nerve. So thank you for watching my video. Do subscribe my channel. Until my next video, Allah Hafiz.